Hello, welcome to Mental Health in the News. The article I'm going to talk about today is about dementia. The Economist published a special report on dementia in the issue that came out for August the 29th to September the 4th. I'm going to talk about the leader, which is entitled The Forgotten Problem. The subheading is entitled The Rising Prevalence of Dementia is a Global Emergency. I'm Dr. Beth Colby, a psychiatrist in London. In the article, the author stated that it was made clear in the special report that dementia is already a global emergency and more people have dementia than can be humanely looked after. It stated that there's no cure in the pipeline and that no solution on how to sustainably look after and pay for people to be looked after with dementia, and that the reason for it being a problem, i.e. longevity, is to be applauded, but in contrast with the speed of a viral infection, the rising prevalence is very slow, so the problem appears less urgent. The paper then goes on to talk about what dementia is and how it affects people. It states, and I quote, that it is an umbrella term for a range of conditions with a variety of causes, of which the most common is Alzheimer's disease, accounting for 60 to 80% of cases. It usually starts with forgetfulness and mild loss of cognitive functioning, but as it advances, people lose the ability to look after themselves. Many require around-the-clock care long before they die. The article states that it does not affect just the elderly, but young people as well, although the elderly are most likely to have dementia. It's a problem in our time as life expectancy is increasing, in contrast to 100 years ago where the life expectancy was just over 30. It's now 70, and in richer countries over 80 years old. One estimate is that 1.7% of 65 to 69-year-olds have dementia, and the risk for this doubles every 5 years after that. Currently, 50 million people worldwide have dementia, and this will treble to 150 million in 2050. Most of the new cases of dementia are in the developing world, where life expectancy is increasing and the populations are growing. Countries with a large elderly population have already felt the size of the problem, and this has been especially so during coronavirus lockdown, where the difficulty of looking people in their own homes has been shown, and that care homes are overstretched and people have had very little individual attention. Another problem that there is that families are shrinking and that single children or grandchildren find it hard to look after their elderly relatives. Even prior to the pandemic, 1 in 4 of British hospital beds were occupied with people with dementia because there was nowhere else for them to go. On a more positive note, the author wrote that the risk of dementia can be reduced if people exercise more regularly, lose weight and smoke less. And in the USA, the Food and Drug Administration is to decide by March 2021 whether to license a drug said to be first to stem cognitive decline in people with Alzheimer's disease. Despite this good news, governments need to act now, as the risk of dementia is rising for much of the world, and any new therapy in the foreseeable future is likely to benefit only some patients and those only partially. Governments need to think about long-term care, how it's paid for, and to decrease the social and economic harm from the growing prevalence of dementia. The author argues that an even more important question than who pays for dementia is who's going to look after people with dementia. If people are looked after humanely and with dignity, the care is very labour intensive, and looking after people requires people. Even though it's classed as low-skilled work and is often poorly paid, care work requires huge reserves of patience, empathy and kindness. The author states that it should be valued more and better paid, and that in countries such as Japan and Britain, immigration will have to be made easier for people who are willing and able to come and do care work. The author ends the article by saying that there's evidence to suggest that around 40% of cases of dementia can be delayed or prevented by changing behaviour earlier in life, but then says that public health campaigns have had a patchy record and cannot actually do something to stop people from ageing. So with no cure and lack of funds, it may be enough to make people give up on the idea of trying to do anything at all. However, this only outlines the fact that the solutions to dementia, much like the disease itself, will take decades to unfold, and that is yet another reason for working on them right away. Thank you for listening. Bye for now.